Gentleman from Florida.
Mr. Speaker, I've just introduced a simple 4-page bill that allows any American to buy into Medicare at cost. Let me explain why I've done that. I have 5 children. When one of my children was born, I found out from the insurance company that the insurance company would not pay for the birth of my child. I had what I thought was excellent health care coverage from this insurance company, but it turned out otherwise. And as a result of that, I had to pay $10,000 for the birth of my child. You know, it could have been worse. Maybe I wouldn't have that $10,000. A lot of Americans face that situation when they have health care bills that their health insurance company won't cover. It could have been worse. I had twins who were born afterward, who were born a month premature, spent weeks in the hospital. God only knows what those bills would have looked like. I probably would have been broke. But the fact is that I felt, like many Americans feel, that I had an adversarial relationship with my insurance company, and that every penny they spent on my care was a penny less for their profits. And that is a fundamentally unfair situation that causes untold health care needs around this country that go unmet, and frankly untold death. And that's why we need another option. We need a public option. We're going to be seeing a Senate bill that doesn't have a public option. We're going to be seeing reconciliation that doesn't have a public option. But America needs a public option. That's why I've introduced this bill. There are other reasons as well. Another reason is that all across this country there are areas, including areas in Florida, where 1 or 2 private insurance companies dominate the market to the extent where they have 80% of. There is no competition. It's a monopoly in the case of 1. It's an oligopoly in the case of 2. Either way, these insurance companies pretty much do whatever they want. They can offer you care or they can deny you care. They can cut you off when you already have care. And they can charge you pretty much anything they want. Well, a public option would change that. In an area where 1 company had 80% of the market, suddenly there would be an alternative. Where 2 companies have 80% of the market, suddenly there would be an alternative. And that alternative is an alternative that is already used by 1/8 of our population. That alternative is Medicare. This simple bill would allow anybody, any American, any permanent resident, to buy into Medicare at cost. And what it does is it takes this enormously valuable public resource called the Medicare Provider Network, and it makes it available to all Americans. We've spent billions putting together a Medicare Provider Network that stretches from Nome, Alaska, all the way to Key West, Florida. We've spent billions doing that, and yet only 1/8 of the population can use it. The most expensive part of preparing a health care plan for any American in any location is to set up the provider network. Hundreds and hundreds of contracts with hospitals, with specialists, with nurses, with testing companies. All these things have to be done before you actually serve the first patient. Well, we have a system like that called Medicare, and yet it's open to only 1/8 of the population. It's as if we were saying that only 1/8 of the population, senior citizens, could drive on federal highways. That's how important the Medicare Provider Network is, and that's why we have to open it to everybody. This is not a plan for subsidies. Everyone would have to pay their own cost. This is not a plan that's meant to help anybody except for the people who cannot otherwise get insurance, or people like me who simply don't trust the insurance companies anymore because of the raw treatment that we've received. It's never going to be any different. The insurance companies are always going to look for ways to chintz you. They're always going to look for ways to charge you more and give you less. And the difference is what they call profit. And that's a system that a lot of people just can't accept anymore. They just don't want it anymore. And for those people who have it in their minds that there'll be some kind of government death panels, what about the real death panels that exist in this country already? The insurance company death panels. The ones that look for rescission when you get sick. The ones that top you out at some small amount of benefits when you have some terminally ill condition. These are the real death penalty. These are the real death panels in this country, and that's why we need a public option. So I'm asking the Speaker and the leadership, if we have to vote on this Senate bill that doesn't have a public option in it, if we have to vote on this reconciliation amendment that doesn't have a public option on it, isn't it time that we finally did something good for America? Isn't it time that we gave all Americans the the right to buy into a public plan like this. Isn't it, in fact, past time that we did something like that, and what's the harm? I say to those people on the other side of the aisle, if you don't want to buy into the public option, that's fine, but don't prevent me and my family and the ones who I love from doing the same. Let us have our alternative, and remember what you said so many times before. You say the government can't do anything right. Well, let's see. Let's see right now. Let's let people buy into the public option through this bill, H.R. 4789, and we'll give it a shot. Thank you very much. I yield the rest of my time.